In the meantime, we're going to get started and just want to say hello and welcome to everybody. You are here for the Lunch and Learn for the MOAs. We're going to hear about home health and a new process that we've been excited to be working on as part of a shared care initiative. So I just wanted to quickly acknowledge that we are all gathering today on the shared and unceded traditional territory of the Katsi, Semiahmoo, Kwantlen, Kwiatkliem, and other Coast Salish peoples. And for me personally, where I am very pleased and honored to work, live, and play. And so with that, I'm going to introduce you to our guest speaker today, Jocelyn McIntosh from Home Health, who I'm not sure if you guys have met her before. We did do a while ago another education session with Home Health, but I do know we have some new MOAs joining us in our community, so Jocelyn's face may be new to you. She's gonna, like I said, she's gonna introduce you a little bit to some of these new processes that we've been able to implement and how those new processes will impact your guys' workflow. So Jocelyn, I'll hand it over to you.
Thanks, April. Hi, everybody. So I work here in Surrey-North Delta, and I've been working with the division and with April now for over a year at least, maybe closer to 2, trying to improve communication and connection between our home health nurses and the physicians in the community. So I'm just going to take a few minutes. I'm going to try and do it in 10 minutes here and zip through this PowerPoint that I had presented, I think, last year to some of the MOAs. So if this is a repeat, I apologize. Okay, so I'm just going to share my screen. Share. Okay, everybody can see that. Which screen am I sharing? Can't tell.
Sharing your team screen.
My team screen. Okay, perfect. Thank you. So I'll pull up the PowerPoint quickly. Okie dokie, slideshow. Okay, so I'm going to skip that slide. I'm going to skip that slide. Okay, so what do we do in home health? So our services are for homebound patients only. So if the patient is not homebound, we may not be providing some of our services. Of course, if they need personal care support, and yet they can still get out of their home, that would be a different story. But for things like wound care, catheter care, occupational therapy, physiotherapy, anything like that, the criteria is quite strict on the homebound status. These are some of the teams that we have here. We have nurses, we have physiotherapists, occupational therapists, we have social workers. We had a dietitian. We have a dietitian. However, she is on maternity leave right now, so our coverage is a bit sparse. So again, we're quite strict on the referrals to our home health dietitian in terms of homebound status and complexity. Most times they'll be redirected to community dietary programs as opposed to home health dietitian. We have a community pharmacist for very complex medical regimes or things like that. And then we used to have a community support worker. I need to take this out. She no longer works with us. Okay, so what do we do? So essentially our nurses have a very broad scope of practice. They go into the homes, they'll do anything from a simple wound dressing to something complex like a vac dressing, which is like a vacuum assisted dressing. They can do catheter changes in the home. They can do IV antibiotics if the person can't get out to outpatient. So again, we're very strict on our homebound status for these types of services. If they have an ostomy or a drain nephrostomy, those types of things, and it's new and they need help learning about it, feeding tubes. And then of course we have our palliative care team. So for those people who want to die at home, can refer to our program and we'll help with symptom management and things like that. We do a lot of complex assessments on people to determine eligibility for our services. If the person is known to our program and is having a medical emergency that could be managed by us, so for example, their catheter is blocked or their bandage is leaking. Instead of going to emergency, they can call us 7 days a week from 8 a.m. to 8 p.m. and we'll have a nurse go out and assess within 24 hours to try and reduce emergency visits. So if someone's calling you with something like that, saying my catheter is blocked, or, you know, and normally you would advise them to call 911, but you know that they're known to home health and they have a home health nurse, you could advise them to call us as well. We have various programs within our long-term care sort of realm, which include home support, so helping people with their personal care, bathing, showering, dressing, that kind of thing. We can put people forward for funded facility placement, so alternate living environments such as nursing care homes or assisted livings if they qualify. We can offer people respite, such as adult day programs, or sending their loved one to a care facility for a short period of time so they can just take a break. So we do all those types of assessments as well. And then system navigation. So we do our best to help people if they don't necessarily need our services. We'll do our best to try and help them navigate the healthcare system a little bit before we discharge their file. So whether that be setting them up with Lifeline or HandyDart, or getting them some equipment in the home, like maybe they would be more successful if they just had a chair in their shower and they could sit down so that they're safe to shower by themselves, or things like that. So we'll help facilitate some of that kind of thing, kind of stuff for them before we would discharge the referral. And then, of course, the goal of all of this is to work closely with our GPs. So the idea of this presentation today is for me to explain to you what that's going to look like and what you can expect to see. So one thing that we do use here in home health, it's called the Paris Communication Tool. And Paris is just our documentation system that we use here. So what it is it will pop up in whatever EMR your physicians use, and it will be an update or order request or those types of things, as opposed to coming through as a fax. We're starting to use this more often. So long as you have the Acceleris program that can translate the information from our Paris program into whatever EMR you use, then you'll notice these popping up, and they kind of pop up where all the lab work pops up for your clients and things like that, or your patients. So you may start noticing that. Of course, we do still have to fax things. So anything that requires a signature, we would fax. So whether that be a medication list, or we need an order for a catheter or something like that, we may still be sending paper faxes. And of course, our nurses know if it's something really, really urgent, that they'll call you at the MOA to let you know, to keep your eye out for it and say, if this needs to be signed today, or whatever the case may be. I'm sure you guys have received those phone calls from us in the past. And then, yeah, like I say, we'll be talking in a second about what you can expect on a quarterly basis from our teams going forward. So just an update on Pathways, where you can find our information. I actually recently just updated all our information on Pathways BC. So when you go to Pathways, we have a page for the Gateway office, and we have a page for the Newton office. Essentially, if you don't know what office your CHN works out of, so for the most part, your GP in your office will be attached to a nurse. CHN stands for Community Health Nurse. And we will be sending you quarterly information on that nurse and all the patients that that nurse sees. So that will be your hint as to every time a referral comes in for that, or that doctor wants to make a referral, every time that doctor in your office wants to make a referral to home health, you know, oh, that's right, the nurse works at the Newton office, I'll send the information to Newton, or vice versa, Gateway. Originally, when we came up with this model 4 years ago, we tried to align, if the GP office was closest to Newton, we would assign that nurse in Newton to that GP, and vice versa. But over the years, that's changed a little bit because, of course, GPs move all the time and we couldn't keep up. So potentially that may not be the case anymore. So that's why we just ask that when you get these quarterly faxes from us, you sort of make a mental note, okay, the nurse for the doctors is out of the Newton office. All referrals are going to go to the Newton office for home health. We also have our ambulatory wound clinic. So at the beginning of this presentation, I stressed that if they're ambulatory or not homebound, we will not be providing wound care, those types of things in the home. So you would make a referral to our ambulatory wound clinic, which is located in Newton as well, on 72nd and 132 approximately. And so that's where you would refer people who have wound care that cannot be managed at home by the client themselves, but the client can get out, you know, then you would be referring to the ambulatory wound clinic. Also included there is just details on what we do, so similar to what I showed you on the previous slides, and then a little bit of information on the COVID-19 monitoring program. Now, I'm not sure that's probably going to be disbanding if COVID continues the way it has been, but for now it still exists. So if you have a patient who had COVID and is struggling with post-COVID symptoms, you could always refer to this COVID-19 monitoring program, and the nurse will kind of check in on them and just make sure they're doing okay. So we've been doing what we call these meet and greets over the last year. And what it has entailed is some of the doctors have participated, and they've come to these virtual meetings where they get to meet their nurse and chat with them, talk about how they want to communicate, things like that. So those have been very successful. And then out of those meetings, we've determined that having these quarterly faxed reports come to the offices would be very beneficial. So that's mainly the purpose of today's presentation, is what those faxes are going to look like. So let me just get out of this PowerPoint. Any questions on what we do in home health before I dive into the whole fax that you can expect? Sorry, I know that was really quick and very kind of Coles Notes, and I may have used some lingo that doesn't make sense, so I apologize for that. But essentially, the whole purpose of this meeting with you guys today is to know where to send referrals for us, and then how to know who the nurse is that's connected to the doctors in your office. Okay. So if there are no questions on the PowerPoint presentation, then I'm just going to jump right into what you can expect from these quarterly reports. So going forward, what we're going to be doing in home health out of both the Gateway and the Newton offices is for all the GPs that have clients actively receiving service through home health, we will be sending, every 3 months, we will be sending a list of those patients to those doctors. The doctors know, okay, I have these 5 patients that home health is seeing, just as an FYI. And it's, you know, it's meant to help facilitate conversation. So potentially the doctor will review that list and then be like, oh, right, Mr. Smith, I meant to follow up and I should probably call the nurse. And so it's meant to kind of, and same goes for the nurses, right? They review their list and they're like, oh yeah, I meant to talk to the doctor about that. It's just meant to help facilitate conversation going forward. The other purpose of the list is just because we do have, as you probably know, quite a bit of turnover in Fraser Health and nursing in general, right? As somebody once said to me, we have ants in our pants and we like to move around from job to job to job. So we often have different nurses attached to the GPs on a regular basis. So the other purpose of sending this fax out is just to let you and the doctor know who is the nurse seeing the patients for that doctor in the community, and give the contact information for that person and stuff like that. So it's just, and it may be the same nurse every time, which is great, but it also just reminds us to update you guys at least every 3 months as to who the nurse is. So this is what the cover sheet will look like when it comes through on the fax. It will have the name of the nurse. It will say I work full-time or part-time, and what that part-time is it 3/4 time, half-time, whatever, and then what office they work out of. So this is where you'll determine whether they're out of the Newton office or the Gateway office. So if they're sending this for my example is going to be Dr. Blinkhorn, just because I've been working with him on this project. So let's say your nurse is attached to Dr. Blinkhorn, and this list you're getting is for Dr. Blinkhorn. Then you know, anytime Dr. Blinkhorn wants to make a referral to home health, you're going to send it to this nurse at the Newton Home Health office. So it just helps you know where your information is going every single time. And even if it's not for nursing. So if you're sending an OT referral or a PT referral, regardless of where the patient lives, if Dr. Blinkhorn is attached to a nurse in Newton, all referrals for all of our programs will go to Newton. Okay. And then it will have the contact information for the nurse. So cell phone and office number. And then it just has, again, a little breakdown of what we do and the services we can refer to within our home health program. So it's, again, just another brief review of home health. And then behind this will be the actual list of patients. So this is what it will look like. And you may have seen this come through 3 months ago. But essentially what it is it's a list of the patients. So it has the patient's name, PHN, date of birth, and then it just tells you that they're actively receiving services through us. So then you would just give this to the doctor, and the doctor would review it and say, oh yeah, that's great, thanks. And that's it. Potentially there's nothing more to do. Potentially they got this 3 months ago, nothing's changed, they have no updates, they don't need to chat with their nurse, or potentially they'll be like, oh, Neville Buckle, right. I meant there's something going on with this person. I meant to connect with the nurse, and it's just a reminder. So if you see these coming through, or when you see these coming through on your faxes, essentially you just give it to the doctor. It says the doctor's name at the top here. And then it's up to them to then do the remainder of the work with it if there's anything further they want to do with the list. And then they can book, care conferences with the nurse and the client for more complex patients, or they can bill for a quick phone call to the nurse about a few of them, right? They might highlight 5 of them that they wanted to talk to the nurse about, and then do a quick bill. And when we do the meet and greets with the GPs, we talk about the different billing codes they can use when they talk to the nurses about their patients. So other than reviewing the list and determining if they want to follow up with us, there's not much else that they need to do with this. It's more just an FYI, and it's just meant to keep that communication open, ensure they know who their nurse is, ensure they know what office their nurse is working out of, and how to contact them. And then it also helps too if, for example, you guys are having a GP leave your office, let's say Dr. Smith is at your office and he's retiring or he's moving to Kelowna. Now you have all our contact information. You can just send that nurse a quick text or phone call or whatever and say, hey, by the way, Dr. Smith is leaving. This is what's happening with his patients, so that we can update our information here. Otherwise, we never get that information. So you may, sometimes this is what happened a few months ago, is we sent out lists to a group of physicians at an office, and we got a message back saying, wait a second, 2 of these doctors don't work here anymore. Well, we have no way of knowing that. So unless you guys let us know. So it's a good way to keep that communication open between us and you guys. So we'll be sending these out in the next 2 to 3 weeks. So before the end of June, before the beginning of July. So you can expect to see them if the GPs in your office have home health clients. If the GP in your office doesn't, then you won't receive this, obviously, because we don't have any clients with that GP. We see I think we have about 3,000 clients on care. So in Surrey, so it's quite a few. So I'd be surprised if there wasn't at least one doctor in your office, unless you're an office of one that doesn't at least have a couple clients with us. Some of the lists are short, right? They might only be 1 or 2 patients, but some of them are long, like Dr. Blinkhorn's 5 pages long. So it just depends how elderly and complex their patients are. Any questions? Clear as mud.
Harpreet, your hand was up there. Go ahead. You're on mute. There you go. You got it. You're golden. Oh, it looks like, so we can see that you're talking, but for some reason, the microphone's not working. Nope. I think she's typing your question into the chat. If you could expand, Jocelyn, on the social worker part, that was Harpreet's comment. She'd like to know more about that piece.
I don't really know what your question is pertaining to, but if you're just wondering what our social worker does, essentially, she's
shaking her head. Yeah.
Oh, okay.
Do you want to know about like the referral side of things, Harpreet? Yeah, the referral.
It's the same referral form. Yep. So all of our services are on the same referral form: OT, PT, dietitian, pharmacy, nursing. You just specify what you want on that referral form that's found on Pathways.
I'm just quickly going to show them from the Pathways side. So when you guys log in, all I did was in the search bar, I just typed in Gateway Home Health. And then the referral form is found at the bottom here. So you would just pick your referral form. And then like Jocelyn said, here, I'll show you. You just pick your service.
And the nice thing about this, so the purpose of this, as opposed to, you may all have the referral information for the home health service line. The difference is this comes directly to us at the Newton or Gateway offices. So you bypass the home health service line, which is our regional intake process. Of course, if the patient lives outside of Surrey-North Delta, if they live in White Rock or Langley, you cannot use this form because you're not referring to Surrey Home Health if the person lives in a different community. So if they live in a different community, you would be still referring through the generic home health service line referral pathway. This is just for Surrey, and it's just meant to expedite and reduce any barriers that may be found when referring through the service line.
Now, Jocelyn, on this referral form, so if it was specifically for social work, would they just click off other and then write in social work here?
Yep, or they could tick off housing, or they could tick off income assistance, right? And they would just put some details, whatever those details might be, and then we would go from there.
There was another question in the chat, actually, before I move into that. Harpreet, did that answer your question? Awesome. Okay, so there's another question here in the chat, Jocelyn. It looks like, so Chantel says that she got the package in March, the cover sheet and patient list. Is there any way that it can be sent out individually as opposed to a group list? So it's easier to attach the record into the patient's file for easy access to find out if we do need to reach out.
Unfortunately, no. So the way it's pulled from our program is as a PDF. So we can only run the report. So we just type the GP's name in, and then the report generates a PDF with that list. I know other doctors had asked, oh, can you put details in about what services they're getting for each patient? Unfortunately, again, no, we can't edit it. It's just a report. So if the GP does nothing with it, then there's, they just toss it. They don't actually do anything. They just kind of look at it. Then I don't know that there's a way that they can actually attach, unless they went through each one and attached each one and tried to bill for that, then that they could do that, if that makes sense.
And just as a bit of background information, I know sometimes hearing no when we're trying to make a process easier can be frustrating, but in the background, we were meeting as a working group with a number of physicians from the community and with the home health team. And we did go so far as Jocelyn had asked, she looked into the IT side of things to see if there was, can we make the list more flexible? Can we add in details? Can we free text some things? We tried some different things. And most of the time we heard back from IT that the answer was no. So the cover sheet that you saw today was kind of the closest workaround that we could make that was going to give the sort of key information that we were hearing that the physicians really wanted. They wanted to know who their CHN was. They wanted to know like what office their patients were at. They wanted to know who their patients were in home health, and then how to get a hold of someone. So some of it, you're right, can be a little bit long. Hopefully, at least the cover sheet will provide a little bit of context too. So it wasn't just that we felt like saying no, we'd try to. And then one last question here in the chat also, Jocelyn, if a patient is in Vernon, do you know how they might refer?
No, you'd probably just have to Google the home health service line for the interior health. I don't know anything about interior health, sorry. It would be the same if they're in Vancouver Coastal or any other health authority. They have their own referral processes. But the home health service line covers all of Fraser Health. So Hope to Burnaby, right? So anybody living in Fraser Health, you can refer through the home health service line if they're not living in Surrey-North Delta. Yep.
Are there any other questions? We're at 1, but we certainly, if someone has another question, please feel free to raise your hand or pop it in the chat.
These are great questions. Thank you.
Yeah, they're great. Okay, doesn't look like there's anything here. If you do happen to think of one once you get back into your clinics, please feel free just to reach out and I can certainly forward that along to Jocelyn. And in the meantime, like Jocelyn said, keep your eyes out. If you haven't seen it yet, keep your eyes out for that new cover sheet and patient list that will be coming out in the next couple of weeks. And if you don't get one, that likely just means that your physician doesn't have home health clients. Those packages will be coming out every 3 months. So at some point you're going to see them come across your desk, I would imagine. Otherwise, big thanks to Jocelyn for putting this together, and I hope you ladies found it useful. And otherwise, I hope you have a great rest of your day. There is a question, can we get the PDF for scope of practice? We're absolutely happy to share that with you. Absolutely no problem. We'll send that out right away. And have a great rest of your day, everyone. I hope your afternoon goes smooth, and we'll see you guys all very soon. Bye for now.
Thank you.